Hello again, I'm Dr. Nev and I'm a licensed psychologist. This is part 4 of my 10-part series of techniques you can use to help you manage your depression. I frequently utilize these techniques with clients in my private practice, and I hope you will find them to be useful as well. If you are experiencing significant distress, please contact your local psychologist. Today's video is all about emotions, so let's get started. The first technique is remembering a very important truth, and that is that you are not your emotions. So I will repeat one more time. You are not your emotions. Emotions are transitory states that come and go. So every emotion that you feel will eventually disappear and dissipate. And then it will also return at some point in time. So remember that you are not your sadness, you're not your pain, you're not your despair. Those are just states, and in time, they will pass. They're states that are in you, but they're not you. So when you're feeling sad next time, just ask yourself, when was the last time I felt sad before today? And how long did it take for that feeling to pass? And did that feeling eventually get replaced with a different feeling? My guess would be yes. So again, it's an important truth to remember that you are not your emotions and that all emotions will pass in time. The second technique is called nonjudgmental noticing. So with nonjudgmental noticing, what you want to do is basically describe your feelings without judging them as being terrible, horrible, unpleasant, wonderful, worst thing in the world, best thing in the world, and so forth. So just describe the feeling for what it is. I'm sad, I'm frustrated, I'm angry, I'm disappointed, but you do not need to be any more dramatic than that and add any of those other qualifiers that make the feeling seem much more severe or much more overwhelming than it has to be. So what this will do is allow you to create a little bit of space between yourself and your feeling and not to over-identify with it. The third technique is called normalizing emotions. So oftentimes when I talk to people, they tend to assume or tell me that they believe some emotions are good and positive emotions, while others are bad emotions or negative emotions. So typically people see joy or love or happiness as good emotions, and sadness, despair, anger, frustration as bad emotions. And I'm here to tell you that that is not true. Emotions just are. They're not necessarily good, they're not necessarily bad. They're just useful sources of data that can give you a little bit of insight of what's happening with you inside, and also maybe what's happening with your environment, some of your decision making, or other pieces of your life that you might need to pay closer attention to. I would also encourage you, when it comes to normalizing emotions, to explore some of your biases about emotions. And for example, many people will tell me that they perceive crying to be a weakness or a sign of not being able to be in control of their emotions. And I'm here to tell you that that bias is completely unwarranted. Crying is normal. Everybody cries. I bet you have cried at some point in time, and you probably will cry again. It does not make you a weak person. And actually, crying can be a positive coping strategy because it allows you to release some of that sadness or that frustration that you're feeling in a healthy way versus punching somebody or engaging in self-harm behaviors. I would much rather you cry and release that emotion positively. So by remembering that you're not your emotions, that certain emotions aren't good or bad, and that all emotions pass in time, you can start developing a much healthier relationship with your feelings. And remember, you're not going to like every single emotion that you feel 100% of the time. And that's okay. If you were feeling happy 100% of the time, you will probably have some type of a mental illness because that's just not a typical state of being for most adults or children. So next time when you're feeling a certain way, just ask yourself, what does your emotion teach you about yourself, about your decisions, and what's currently happening in your life? Well, thank you so much for watching part 4 of my 10-part series on depression management. If you found this video to be useful, I hope you will also check out part 5. Please subscribe if you would like YouTube to notify you anytime I post a new video. Thank you so much for your time and take care.